So I'm Melissa Hall. I'm here to talk about digital transformation and how my community hospital did a journey. So full disclosure, I used to be the CIO, and then I became the CNO about 110 days ago. So it's a little different journey that I had, but let me tell you a little bit about what we did when we digitally transformed. So here we're just going to talk a little bit about Calvert. Probably nobody's heard of it. It is a digital transformation trends. We're going to talk about how we did that, our journey, why we did it, why we actually started it, where we are now, and where we're going. Remember, I'm the chief nursing officer now. I don't really have a lot of control. So Calvary Health is in southern Maryland, about 30 miles southeast of DC. So we're right on the Chesapeake Bay. This is a 104-year-old community-owned health system. We're actually a standalone rural-based hospital surrounded by MUMS, MedStar, John Hopkins, and Luminous. So we're kind of our own little entity. We have about 30,000 ED visits, 50,000 outpatient visits, 3,500 surgeries, and about 5,000 admissions. So if anybody knows anything about Maryland, the more admissions you get, the worse it is for you. My button's not working. So by the numbers, we have about 1,400 employees, so we are the largest private employer in Calvert. We serve about 420 patients with about 350 providers, not all employed. We only employ probably about 35. So it's all the providers around in the area with us. And we have 45 specialties that we actually partner with or we either provide. It just depends on how it is. I don't know how to get this thing to go again, sorry. So this is kind of like our digital transformation timeline. So I have to say that the prior CIO before me, I was his director, he put some of this in place, and then I kind of fine-tuned it and did a few other things, just from my clinical background more than anything. One of the big things is about mobile health and telemedicine because of COVID and everything, but now that I'm the CNO, the big thing for me is virtual nursing, and I'm really trying to figure out how to get that in place. Of course, we also have big data analytics that we're trying to do as a standalone hospital, and then cloud computing, which is really what we're going to talk about today. Blockchain and robotics, we actually have I was joking with somebody, we have a robot coming to our hospital. Nobody knows how to use it, but we got one. So it's kind of crazy, the things that you get. The metaverse, Mike and I were talking about that earlier. We're really excited about that and what it's going to bring to us and how things are going to change for us in the future. And then, of course, cybersecurity, that's everywhere. So our drivers were, COVID-19, like everybody else. We had to have a lot of flexibility, and we had to be able to be very mobile, which was very hard for Calvert. It's very conservative and very risk-adverse. Cybersecurity and not just ransomware, that was like a big thing for me because I was a CIO and a nurse, and I felt like I was doing cybersecurity via Google. So I actually had to hire somebody to help me because it was very scary for me. And then we used to have tape-based backup for our EHR, and that was, you only got as good as what the tape could take. And then, of course, we're always focused on patient safety and patient care. I think they turned up the music just because they knew I was talking. So one of the things that I'm here to talk about is how we did backup DAR. So we used to have our system backed up. We actually had it to tape for our EHR. And then we went to the cloud, and it was 48 to 72 hours to come back in. And so I actually reached out to my partner, Healthcare Triangle, and with them in AWS, I actually got our EHR system into a whole backup that actually it's back up in under 2 hours, and nobody even knows that it's running. And I felt like that was a huge, huge win for a community-based hospital. That's not something that most standalone hospitals can do. And so AWS and Healthcare Triangle really did work together to help us. and make sure that what we have can come back, and it works. And so, cyber insurance, those who are in the IT world, you have to prove to them that you can fail it back. And we did it, and like I said, nobody even knew we did it. Nobody, not even the ED, and they like to complain. So now we're really looking at data. That's the informaticist in me, and that is how can I get all the data in one place and make it easy so we can have governance and we can make sure that everybody's getting what they need. And so we're looking at this Data Easy, high trust, certified data analytic platform to be able to pull in all these disparate systems we have and make it so that we actually have something that's usable, which, is kind of hard for some hospitals. So this one is about coming back up in 6 hours and the amount of storage that you can have and the fact that it is easy to use, especially for our users, because it's a lot of clinicians and we don't like to think too much. Next, so we are a Meditech site. I know they're right over here somewhere. We also have NextGen and we have some other stuff. And so all the stuff that's not Meditech, we are moving is our goal to get it on the same platform that Meditech is on so that it can also come up within 2 hours, which means then now we have a really good, resilient system and we know what we can do with it. And then, of course, all of us have Internet of Things. And again, I'm not in control anymore, so I can only, use relentless pressure on the outside. Luckily, the CIO used to report to me, so he's kind of nervous if I come knocking, let's just say. Any questions? Did I do my 10 minutes? I don't know. I think I ran through that thing pretty quick. I think I did good. Thank you. Thank you, everybody.